Okay, let's be honest. Does the very thought of a dental injection make your palms sweat? If it does, you are definitely not alone. We're about to pull back the curtain on one of the most common and, most feared procedures out there, especially when it comes to kids. Let's really get into the science of how that dental shot actually works.
For so many of us, it's this moment right here. The needle. It's pretty much a universal fear. And for dentists, particularly pediatric dentists, getting this one moment right is absolutely crucial. I mean, this can set the stage for a person's entire life of either positive or, really negative feelings about going to the dentist.
So how are we going to get from that fear to actually understanding what's going on? Well, here's our roadmap for this explainer. First, we'll tackle the fear itself. Then we're going to unpack the cool science of how numbing works. We'll even peek inside that little glass cartridge. After that, we'll explore the art of the injection, talk about managing what happens after, and finally, we'll look at some amazing new tech that's changing the game.
You see, for a child, that injection isn't just some small part of the visit. To them, it can feel like the entire experience. Their whole memory of the appointment can hinge on this one event, and that can color every single trip to the dentist for years to come. So the challenge is huge, but the goal? It's actually really simple.
The real solution here isn't just about what's in the syringe, it's all about the delivery. Dentists, especially pediatric dentists, are masters of what's called behavior guidance. This means they choose their words incredibly carefully, saying things like sleepy juice instead of shot or needle. They use distraction, and they rely on a technique so smooth and so masterful that the kid barely even notices what happened. It's really part science, part magic, part art.
Okay, so how do we actually stop pain? I mean, how does it really work? Let's dive into the science. The answer is hiding in a class of drugs that perform this kind of temporary magic trick on our nerves.
So here's the official definition from the American Academy of Pediatric Dentistry. But let's break that down. The two words you really got to remember here are temporary and reversible. We're not shutting anything down for good. We're just hitting the pause button on pain signals in one very specific spot, all while you're completely awake and well.
So how does this magic trick work? Well, think of a pain signal as a message that has to race down a wire, that's your nerve, to get all the way to your brain. For that message to keep moving, these little tiny gates, called sodium channels, have to keep opening and closing all along the nerve. Local anesthetic molecules, they are the ultimate bouncers at the club. They show up, they stand right in front of those sodium gates, and they just block them. The pain message gets stopped and distracts, and it simply can't get to the brain. No message, no pain. It's honestly that elegant.
All right, now let's break down the tool that delivers this magic, the anesthetic cartridge. Yeah, it might look a little intimidating, but it's actually this carefully crafted cocktail of different ingredients, and every single one has a very specific job to do.
So what's actually in there? Inside that little glass tube, you've got 5 main things. The main drug that does the numbing, something to make that numbness last longer, a preservative, and then basically just salt and water to make sure the whole solution is compatible with your body. Let's zoom in on the 2 most important ingredients.
First up, you've got the star of the show, the local anesthetic drug itself. This is the molecule, the active ingredient that physically blocks those sodium channels we just talked about. This is the stuff that stops the pain signal cold.
And then you have the crucial supporting actor, the vasoconstrictor, which is usually epinephrine. Its job is to gently shrink the blood vessels right there in that one spot. This basically traps the anesthetic exactly where the dentist wants it, which does 2 really important things. 1, it makes the numbness last way longer, and 2, it keeps the drug from getting washed away into your bloodstream too quickly. So it's not just for effectiveness, it's a huge safety feature too.
Now, these anesthetic drugs basically come in 2 main families, amides and esters. You've probably heard of lidocaine, right? That's an amide. And benzocaine, the stuff in those numbing gels they put on your gums, that's an ester. So what's the big difference? Well, true allergies to amides are incredibly rare. That's why they are the absolute go-to, the gold standard for injectable anesthetics. Esters, on the other hand, have a slightly higher chance of causing allergic reactions, so they're mostly just used on the surface as topical gels to pre-numb the area before the actual injection.
Okay, so we've got the right drug in the cartridge, but believe it or not, that's only half the battle. Where and how you inject it is just as critical. And this is where a dentist's skill and deep knowledge of anatomy really shines. Dentists basically use 2 main techniques. The first is an infiltration. Think of this like numbing a very small, specific target, like just 1 or 2 of your upper teeth. They're just aiming for the tiny nerve endings right there. A block, on the other hand, is the big one. That's for when you need to numb a whole section of your mouth, like all your bottom molars. For that, the dentist aims for the main nerve trunk before it splits off, which numbs that whole region in one go.
And this is a perfect example of why pediatric dentistry is its own special field. That target for the big nerve block in the lower jaw, it's a little opening called the mandibular foramen, is in a totally different place in a child's skull than in an adult's. It's actually lower and a bit further back. A pediatric dentist knows this instinctively and adjusts their injection angle to make sure that anesthetic lands in exactly the right spot. It's pretty amazing.
All right, the procedure's done, the tooth is fixed, but the job isn't over. The numbness sticks around for a while, and managing this period correctly is the key to avoiding some really common and totally preventable problems.
So let's just walk through the potential issues. By far, and I mean by far, the most common problem is a patient, especially a kid, accidentally biting their own lip or cheek because they just can't feel it. The much more serious issues like toxicity or a lingering numbness called paresthesia are extremely rare. The main takeaway here is that prevention is simple. You just have to watch the patient, remind them and their parents not to eat, and sometimes the dentist will even place a cotton roll in there as a physical reminder, hey, don't chew here.
And you might be wondering, why does that cheek biting even happen? Well, it's because the nerves that go to your lips, your tongue, and your cheeks are different from the nerves that go directly to your teeth. This means the feeling in your soft tissues can stay gone for up to 4 hours, long after the numbness in the tooth itself has started to wear off. And that creates this window of time where there's a real risk for an accident.
So we've gone through the science and technique that dentists are using right now. But what's really exciting is that the future is already here, with some incredible new technologies designed to make this whole experience even more comfortable.
First up, meet the wand. And right away, you can see it doesn't look like a typical syringe, and that is the entire point. A tiny computer inside controls the flow of the anesthetic, delivering it so slowly and so steadily that many patients don't feel the injection at all. See, it's often not the needle poke that hurts, it's the pressure of the fluid going in too fast. This technology basically eliminates that sensation.
Then there's this other super cool innovation, and it's all based on something called the gate control theory of pain. Devices like the Vibroject add a gentle vibration right at the needle. Now, your brain has to process both the vibration signal and the pain signal at the same time. But because the vibration message travels on faster nerves, it gets to the brain first and creates a kind of traffic jam that actually blocks the slower pain signal from getting through. You end up feeling the buzz, not the poke.
And hey, remember that annoying lingering numbness we were just talking about? Well, guess what? There's a solution for that now, too. Reversal agents can be injected right after the procedure is done. They work by increasing the blood flow to the area, which helps wash away the anesthetic much faster. This can literally cut the time your lip and tongue are numb in half, which dramatically reduces the risk of a patient biting themselves later.
So you see, it all comes back to this. The psychology, the pharmacology, the anatomy, all this amazing new technology, it's all working together towards one single ultimate goal, to make the dental visit a safe, effective, and comfortable experience so that people, and especially kids, grow up wanting to take care of their teeth for the rest of their lives.
When you demystify a process like this, when you pull back the curtain and see how it really works, you take away its power to create fear. It just goes to show that with a little understanding and some cool innovation, even our most deep-seated anxieties can be overcome. And that just leaves us with one really exciting question. If the needle isn't scary anymore, what's next?